Hi there, my name is Dr. Sarah Bracamontes. I am a chiropractor and cranial sacral therapist here in downtown Los Gatos at 223 West Main Street, Suite D1, and in the Farwell building. I am happy to be a provider here in this wonderful community, and I actually made this video to give you an idea of basically what happens in this office. If you were watching this video because someone referred you to my website to get a better idea of the therapies that I do, I will try to explain them as simply as possible, and hopefully it gives you good information so that you can research a little bit better or understand a little more of the type of therapy that I provide. First visit is usually about a 50-minute visit, and I do send out questionnaires to ask you basically general information and what a history of any issues that you may have had in the past, whether your injury is from hurting your knee while you were skiing a few weeks ago, or because you are at a desk job and you're behind a computer for very, very long hours. Maybe it's just stress in general, and we all have been through quite a bit in 2020 and 21. And to date, we're getting stronger. A lot of issues with that whole anterior carriage and the poor posture. So that is very important to address and to give you exercises and certain cues to be able to do things at home for yourself. The techniques that I do provide are called activator methods and Cox decompression techniques. These two therapies are scientifically proven chiropractic techniques. That means that there is a lot of research behind these therapies that shows that the work that I do in finding the subluxations can be found again by another provider that does the same thorough work and gets feedback from your body. In that sense, I don't do the cracking and popping, a traditional way of adjusting, which is most commonly known as the diversified method. There are very many different types of techniques and ways to adjust in chiropractic, over 60 or so. Two scientifically proven ones are activator methods using this instrument here, and this instrument has the ability to move a bone 2.5 millimeters 300 times faster than my hand can, and it is specific for one segment at a time, as opposed to what my hand can move about 2 to 3 segments. And so the way that this technique is done, it is the patient goes face down on the table, and then I will look at your leg length. One leg will be shorter than the other. That is not an anatomically shorter leg per se. It can be, but the probability is that it would not be. It might just be a postural thing, because in our hips, one leg will be stuck in one position more than the other, most commonly, and that gives me the feedback that I know to ask your body the isolation test that I ask it, that I have been trained in for the last 17 years with this technique. This is the therapy that I have been using, that I have found to give my patients the great relief. Even though it seems like it's really not doing anything, it's very specific, and we get to the issues and we address them, and we get a great result from them. So as you will see, this is Handsome here, and Handsome helps me to be able to explain to you what's going on in your body and help you to understand. I'm very visual myself, and I just feel like showing you visuals of the area of your body is very important. So for example, if we have an issue that I find, it goes just right into that joint to move it. I can move ribs this way, I can move the humerus here, scapulas are a big thing. We start going forward with our bodies and our postures, like at this area. So it's very important to address this area with a lot of this instrument, which I have to confirm there's an issue when I do your leg length and have you do isolation tests. I'd like to show you the muscles, where your muscles are, your IT band, your hamstrings, your glutes, so you can understand better of what's going on. And while I'm doing these therapies, I also use this table here. You can see part of it. It's called a Cox table, and this is a specific table that helps with disc herniations, with disc degeneration, stenosis. We also have a portion of the table that helps traction out your neck so that we get the neck tightness when you get numbness in your fingers, anterior neck carriage, have had whiplash, have lost your neck curve. This table is amazing. It's so beautiful. So when I do the treatments, I do use these beautiful essential oils. I usually only use frankincense and lavender because they're the most neutral to treat people with, and they're very calming. I also integrate this Aaliyah. I hope I'm pronouncing it right. It's a muscle rub, and it has, I believe, 7 or 8 wonderful anti-inflammatory products that they're very proud of. Polarized, CBD, arnica, turmeric, ginger, mint, and a few others that you can go to their website and find out. But I use this muscle rub when I'm working on you. And I also have been for many years using this comfrey salve that comes from the Kauai Pharmacy in Kauai, Hawaii. And comfrey is known to help heal even the bones. So it doesn't have any scent to it. I do like to use this as well. I do always have a diffuser going in the office with either frankincense or lavender, and it's from doTERRA because I know that doTERRA is a very clean essential oil. Of course, the session, when you come in for your session, it is all about you, so I do not get insulted by any issues that you may have. I want you to feel that it is a safe place to heal and to also receive your therapy. I do a beautiful technique called cranial sacral therapy that is wonderful. It's an energy technique. It's an osteopathic technique developed by Dr. John Upledger. And you can go to upledger.com to learn more about that. But that technique helps to calm the nervous system. It's cranial sacral therapy, so we monitor the cerebral spinal fluid going from the cranium all the way down to the sacrum, and then there's different diaphragms in the body that can alter the way that the cerebrospinal fluid is able to flow through the body, and we trap a lot of tension in the body, so helping to do this nice gentle 5 grams of pressure technique really helps. I do integrate it into at least balancing you out after we've treated you. Major thing also that I integrate is functional exercise, getting you to do something or integrate it somehow into your lifestyle, because we have to get you stronger to be able to move forward and be able to live with whatever the spinal condition that you're dealing with is, either improve it or slow down the issue that's going with it. And I am here to help you, but the biggest and the greatest person that can do this is you. So it's you, your body, and myself. And with the corrections that we make in the office, with the exercises that I show you as a certified Pilates instructor, practitioner, doer, and I really love everything Pilates. He should be a doctor. Joseph Pilates was a Pilates instructor that basically started as controlology, which is helping the mind control the body. And so he really believes with a strong body, you can continue to do whatever you need to do in life. So adjusting you properly, teaching you Pilates-based exercises to help you function better is very important. With that being said, I'm going to turn the camera right here to this beautiful piece of equipment, which is a Pilates reformer. Right now the mat bed is on there, but it also has a carriage, and the carriage helps slide as you lay supine face up on this carriage, and you put your feet here, and we're able to move you into some footwork, into also connecting the core and integrating your arms and moving the scapula. It has a lot of different springs on there, resistance, so that we can help you test your body strength and then see how we can help you move forward and be stronger. So that is pretty much a lot of information that I've given you, and I hope this helps you understand what can be done for you, I'm here to help. I would love to be part of your healthcare team to get you to a better place.